But when you think about the older patient, you must remember that most of them do not have dementia. Most of them speak a language you can understand. And most of them can make decisions for themselves. Most of them can hear you. And most of them can see you. This is what happens when in my practices, I have to remind people to speak to the patient, because it's become such a mental barrier that communication in older people is difficult. Doctors and a lot of healthcare professionals avoid it altogether. They automatically look for their children and make the beeline for their children and start talking to them. Sometimes they just make the beeline for the person next to the patient who looks younger, and talk to them without even asking whether they actually are their adult children or a relative at all. So when it comes to communicating with older people, we have to speak to them. I know it sounds like a really weird concept, but yes, speak to the patient. And this is what we've consistently failed to do. When you next see an older patient as a healthcare professional, please remember that you must first respect the patient's right to privacy. We must always maintain patient's confidentiality, and we must always maintain patient's dignity at all times. And that really is part of good medical practices. But what I hope that if you leave this talk with nothing else, you will remember that next time you speak to an older patient, you will actually ask everyone else next to the patient to leave the room first and verify that the patient is actually happy for somebody else to be in the same room as them when you have that private conversation. Medical conversations can be very intimate, and by having somebody else in the room and asking somebody else about the patient, you lose a lot of information, vital information, but most of all, you have violated the person's right to confidentiality. So let's talk about the unconvinced patient. Most of the time when I ask my students, why is it difficult? Why do you find it difficult to talk to your older patient? They don't want to talk to us. They don't want to be in hospital. They don't want to tell me what's wrong with them. They don't want to tell the doctor what's wrong with them because they never wanted to be there in the first place. Someone brought them there forcibly without their permission. It is very difficult. And so a lot more needs to be invested in winning the trust of that older person. But you also need to respect the patient's wishes not to be there. And if that is the case, and they adamantly affirm that they do not want to be there, as a healthcare professional, perhaps we should respect their wishes and facilitate a discharge. But if we do feel that a discharge is unsafe, for instance, the patient's ability to make decision is in question, or more commonly, the family will not let you, then perhaps or the patient would be willing to stay after all, then you'll have to invest the time in trying to actually win this person over. It might take more than one encounter, but usually, most of the time I suppose for a geriatrician, it's a magic formula. Yeah. So breaking the ice is very important. And this gets easier and faster the more older people you see. So the only way of getting good at talking to an older person is to do it more often. And you will find what older people like talking about. But as a general rule, getting to know them is important. Respecting them for their status in society is extremely important. Find out what they used to do before they retired. In fact, some of them would still be working. Some of them would still be actively contributing to the economy, and some of them holds very important decisions. So without recognizing that the person in front of you is someone to be respected, you are not going to win this battle. Next, listen to them. We always say, ask the open question, what can I do for you today? Stop and listen. And don't interrupt. They will stop, trust me. And usually the patient stops in less than 1 minute. It takes time to earn their trusts. And so sometimes the first 3, 4, 5 minutes of the conversation is not about why they're in hospital, but about rather mundane things to you and me, but something very important to them as to what they used to do, talking about politics, what's happening to our current country, talking about their hometown, their favorite food, and also finding out the underlying agenda, why they are really here.